Hello everyone. As we grow older, maintaining an active lifestyle is often touted as the secret to a long, healthy life. Physical activity, particularly walking, is commonly recommended for seniors due to its accessibility and low-impact nature. For many, walking is synonymous with staying fit and warding off the physical decline that can accompany aging. However, recent medical studies and expert opinions have shed light on a potentially surprising truth. Walking too much after 70 might actually accelerate the aging process and contribute to physical wear and tear rather than preserving vitality. While walking is a fantastic exercise for seniors when done properly, overdoing it may do more harm than good. In this video, we will dive into the reasons why walking too much can exacerbate the effects of aging and suggest alternative exercises and strategies to help seniors maintain health, strength, and energy while avoiding the potential pitfalls of excessive walking. Let's start by acknowledging that staying active as we age is vital to maintaining physical and mental well-being. Activity reduces the risks of chronic diseases, promotes heart health, and improves cognitive function. For older adults, exercise is particularly important as it helps preserve muscle mass, bone density, and joint flexibility, all of which naturally decline with age. Walking is often seen as a go-to exercise because it's accessible, requires no special equipment, and can be done at almost any time. It has been shown to provide many benefits, such as improved cardiovascular health. Regular walking strengthens the heart and can reduce the risk of heart disease and stroke. Better mental health. Walking can improve mood and reduce symptoms of depression, anxiety, and stress. Enhanced mobility. Walking increases joint mobility, keeping the body agile and able to perform daily activities with ease. Weight management. Walking helps burn calories and, when combined with a balanced diet, can aid in maintaining a healthy weight. But while walking is beneficial, overdoing it can actually do more harm than good. Why walking too much after 70 can accelerate aging? When it comes to the question of how much walking is too much for seniors, the answer isn't always clear-cut. The problem arises when the body, which has naturally aged and weakened in some ways, is subjected to excessive stress. Although walking may seem like a gentle exercise, when taken to extremes, it can cause a number of issues that contribute to premature aging. Here's why walking too much can accelerate the aging process in seniors. 1. Wear and tear on joints. Joint health is one of the most significant concerns for seniors, particularly after the age of 70. With age, the cartilage that cushions the joints begins to degrade, leading to conditions like osteoarthritis. When an individual walks for long periods of time, especially on hard surfaces or uneven terrain, it puts undue pressure on the knees, hips, and lower back. Over time, this pressure can wear down the cartilage further, exacerbate joint pain, and increase inflammation. For seniors already living with arthritis or other joint-related conditions, excessive walking can cause severe discomfort and even long-term damage to the joints. In some cases, chronic overuse of the joints from long, frequent walks can even lead to the development of other conditions, such as tendinitis, where the tendons that support the joints become inflamed and painful. 2. Increased risk of injury. One of the risks of walking excessively is the increased likelihood of injury, particularly among older adults. As we age, our bones naturally become more fragile, and balance can deteriorate. The combination of weakened bones and reduced balance means that falls become more frequent and more dangerous for seniors. Walking long distances, especially outdoors, increases the risk of tripping, falling, or twisting an ankle. Additionally, the repetitive movement of walking for long hours can lead to overuse injuries, particularly in the feet, ankles, and knees. Chronic pain, muscle strain, and even stress fractures can occur when the body is asked to endure more than it can handle, putting seniors at a higher risk for debilitating injuries. 3. Muscle loss and fatigue. After the age of 70, muscle mass begins to naturally decline, a condition known as sarcopenia. This loss of muscle mass and strength contributes to frailty, decreased mobility, and an increased risk of falls. While walking is generally a good way to strengthen muscles, excessive walking can cause muscle fatigue, leading to weakness and loss of strength, especially if the body isn't allowed to rest properly. When seniors walk excessively without incorporating strength training into their exercise routines, they can inadvertently exacerbate muscle loss. Walking for hours on end can deplete the body's energy reserves, leaving muscles tired and vulnerable to injury. Moreover, the repetitive motion of walking, if not complemented with other types of strength-building exercises, may contribute to muscle imbalances, where certain muscle groups are overworked while others become underdeveloped. 4. Cardiovascular stress. While walking is generally considered heart-healthy, overexertion can place significant stress on the cardiovascular system, especially for seniors with underlying heart conditions. Long, intense walks can increase blood pressure, elevate heart rate, and cause excessive strain on the heart. In some cases, seniors with pre-existing conditions like arrhythmia, hypertension, or a history of heart disease may experience worsening symptoms from prolonged walking. It's important to note that seniors who engage in excessive walking without proper recovery time may experience dehydration, fatigue, and other signs of cardiovascular strain. This is especially true in hot or humid weather, where the risk of heat exhaustion and heat stroke is higher. 5. Bone density loss and fragility. Seniors already face the risk of osteoporosis, a condition in which bones become brittle and fragile due to loss of bone density. Walking, while beneficial for bone health in moderation, can worsen bone fragility if done excessively. The constant impact of walking on hard surfaces, particularly for extended periods, may contribute to microfractures in the bones, especially in the spine, hips, or legs. These microfractures can accumulate over time, increasing the risk of serious fractures from falls or even routine activities. In this sense, excessive walking may inadvertently increase the likelihood of bone injuries in seniors who are already at a higher risk due to the natural decline in bone density. Recognizing the signs of overdoing. If you're over 70 and engaging in regular walking, it's essential to listen to your body and recognize the warning signs that you may be overdoing it. Some red flags that indicate you might be walking too much include persistent joint pain or discomfort, particularly in the knees, hips, or lower back, which doesn't subside with rest. Increased fatigue after walking, where you feel more tired than usual or have trouble completing your regular daily tasks. Muscle weakness or a sense of instability, especially after long walks, which can affect balance and increase the risk of falls. Shortness of breath or dizziness, which may suggest cardiovascular stress. Swelling or stiffness in your legs or feet, indicating that your body isn't getting enough time to recover between walks. If you experience any of these symptoms, it's crucial to scale back on your walking regimen and consult a healthcare provider for guidance. If you find that excessive walking is taking a toll on your body, don't worry. There are plenty of other ways to stay active, strong, and healthy without risking injury or exacerbating the effects of aging. Here are some practical strategies to help you maintain your physical health as you age. 1. Incorporate strength training. Strength training is crucial for maintaining muscle mass and bone density as we age. Incorporate light resistance exercises into your routine, such as weightlifting, resistance band exercises, or bodyweight movements, like squats, lunges, and push-ups. Aim for 2 to 3 strength training sessions per week, focusing on all major muscle groups. This will help combat muscle loss, improve joint stability, and boost metabolism. 2. Try low-impact activities. Instead of walking long distances, consider low-impact activities like swimming, cycling, or using an elliptical machine. These activities offer excellent cardiovascular benefits without putting strain on the joints. Swimming, in particular, is a full-body workout that builds strength, improves flexibility, and reduces the risk of joint pain and injury. 3. Balance and flexibility. Exercises. As we age, balance and flexibility become increasingly important. Consider incorporating activities such as yoga, tai chi, or Pilates into your routine. These practices not only improve flexibility and range of motion, but also enhance balance, reducing the risk of falls. Yoga in particular can be adapted for seniors, with gentle poses that promote both physical and mental well-being. 4th, mindful walking. If you enjoy walking but want to avoid overdoing it, try mindful walking. Rather than focusing on distance or speed, take a slower, more intentional walk. Pay attention to your breathing and the sensations in your body. Walk in natural surroundings, which can reduce stress and improve mood. Mindful walking helps reduce physical strain while still offering the mental and emotional benefits of exercise. 5. Allow rest and recovery. Rest and recovery are essential components of any exercise routine, especially for seniors. Ensure that you're giving your body time to recover between workouts or walks. Allow at least one day of rest for every 2 to 3 days of physical activity to prevent muscle fatigue, joint strain, and overuse injuries. 6. Consult with a healthcare provider. Before starting or adjusting your exercise routine, especially if you have existing health conditions, it's wise to consult with a doctor or physical therapist. They can provide personalized recommendations based on your health status, fitness level, and goals. While walking remains one of the most accessible and effective exercises for seniors, moderation is key. Overdoing it can contribute to joint pain, muscle fatigue, and increased risk of injury, which may accelerate the aging process. By diversifying your physical activity, incorporating strength and balance exercises, and allowing your body proper rest, you can maintain your strength, mobility, and vitality as you age. The goal is not just to stay active, but to stay active in a way that supports long-term health and independence. Embrace a balanced approach to exercise, and you can continue to live a vibrant, fulfilling life well into your later years.